It's wonderful to be here at the beautiful Langara campus. You know, I haven't been here in a while, Premier. In fact, you know, some people say I haven't been anywhere in a while, except rooms isolated in various parts of the province. So it's great to be here today. I want to acknowledge that we're on the traditional territory of the Musqueam, of the Squamish, of the Tsleil-Waututh First Nation. I want to extend our gratitude, the Premier, of the government, of everyone here, to Langara College for allowing us to use their classroom for this announcement today. Langara College is one of the sites where internationally educated nurses do their triple track assessment. A single competency assessment is administered by the College's Nurses and Midwives and Nursing Community Assessment Service. It allows the college to identify the readiness of an IEN to work as a healthcare aide, a licensed practical nurse, or a registered nurse in British Columbia. So it's fitting for today's sequel announcement to one we made in April to take place here. It's always my pleasure, and it's our pleasure to share the latest news about the foundational work we're doing together, we and our partners, to support and strengthen our public healthcare system and build on our Health Human Resources Plan. So I'm going to introduce to you the people who will be speaking today. Premier David Eby will be first. Harwinder Sandhu, the Parliamentary Secretary for Senior Services and Long-Term Care, and the MLA for Vernon-Monashee will be speaking. Aman Grewal, the President of the BC Nurses Union. Good to see you, Aman. Cynthia Johansen, CEO of the British Columbia College of Nurses and Midwives. Jenny Arsenault, registered nurse and internationally educated nurse, who was part of our first announcement. She did so well. We brought her back for the second time. It's incredible. I was there too. They brought me back, but they had to. That's the difference. That's the difference, Jenny. And Monique Wee, who's a registered nurse and internationally educated nurse. Nice to see you. I want to also introduce some other people who are here, in particular, Susie Chant, the MLA for North Vancouver Seymour, who's the Parliamentary Secretary for Accessibility and, of course, a registered nurse like Harwinder, so we are well represented here. As well, I want to introduce Rita Parikh, the Executive Director of the Nursing Community Assessment Service. Rita's over there. Rita, I want everybody to know, in my last job prior to being elected, succeeded me in that job. So, you know, she might be the next Minister of Health. We'll see if that pattern continues. We're so happy to see all of you in the new year. And so, as all of you know, in September of 2022, we announced our Health Human Resources Strategy, which outlines 70 actions to strengthen BC's health workforce and build a stronger healthcare system for all of us. Since I have been Minister of Health, we've added net new 38,000 new workers, doctors and nurses and healthcare assistants and health sciences professionals, and we have to do it again, and then we have to do it again. Today, I'm happy that we're launching another step in this plan, and to deliver the announcement, I'm honored to invite the Honourable David Eby, Premier of British Columbia, to the podium. Premier Eby.
Thank you very much, Minister Dix. Thank you for the kind welcome, and so glad to be joined by so many talented and remarkable British Columbians here today. Joining you today on the territory of the Musqueam people, the Squamish and Tsleil-Waututh. And I would like to take a particular moment to thank my colleagues in the legislature who are nurses joining us today. Harwinder and Susie, wonderful to see you both, and glad to see you bringing your personal experiences and professional experiences to today's announcement. And also wanted to thank very much Cynthia Johansen, the CEO of the BC Colleges of Nurses and Midwives, and also Aman Grewal, the BC Nurses Union representative who's here today, because it's my understanding that we wouldn't be here today without the support and encouragement that both of you have brought and the leadership that you've brought to this and working with Minister Dix. So thank you so much for that. Also, certainly last but not least, the reason for the season and the announcement here, we have Jenny and Monique, both internationally trained nurses who are living examples of the commitment to nursing and service to British Columbians, and the remarkable gifts and talents that they bring to our province. I wanted to say thank you so much for joining us today and for speaking about your experiences. We're all here today with a shared goal, and a common goal. We want to make sure that every British Columbian gets the health services that they need. It's as simple as that. It's a key focus of my plan for the first 100 days in office. And as we start a new year, we remain focused. I remain focused on delivering those results that people can see and feel and touch and experience in their lives. Within the first 50 days, British Columbians saw us take action on public safety, making communities safer by tackling those repeat offenders, those violent offenders, making sure that they remain in custody and off the streets. We're tackling the housing crisis, opening up units for rent that were previously barred from rental by unfair rules, making sure that families can stay in their homes and not be evicted by unfair rules. And we're making sure that our public healthcare system remains strong today and for generations to come. We're building new hospitals, opening new urgent primary care centers. We're building the first new medical school in generations in Western Canada, delivering a new compensation deal for doctors, bringing 4,600 healthcare workers back into the public sector and hiring thousands of nurses. But we need to do more. Hiring and training more nurses is part of our own ongoing work to make sure that healthcare is accessible to all British Columbians. And still, we know the demand for the skills and expertise that nurses bring to the job every day has never been more in demand in our healthcare system. There are high-skilled and experienced nurses who want to get to work in our system now, but are facing barriers preventing them from delivering the services that British Columbians need. We need to fix that. Just as we made changes for internationally trained doctors, we need to do the same for nurses. And that's why we're here today. I'm pleased to announce new supports in a faster assessment pathway that will get more nurses working in BC's healthcare system faster. For nurses returning to practice, there will be help with the costs of re-entering the workforce. These are nurses who may have taken a break for practice for any number of reasons and want to come back but are facing financial or other barriers to coming back. We want to support them in coming back to work. This includes application and assessment fee support, along with travel expenses support. Additionally, bursaries of up to $10,000 available for any additional education that those nurses need who are coming back to practice in order to be able to get to work. For internationally trained nurses, we've committed $1.3 million to set up a new pathway to streamline the licensing process. This will help our partners, the BC College of Nurses and Midwives, and the Nursing Community Assessment Service, assess more applications faster. Now, what is that going to mean in real terms for British Columbians? Well, right now, candidates in this scenario are waiting 3 years to be granted registration. Our goal is to bring it down with these reforms to between 4 to 9 months. We also want to reduce any potential financial barriers. So we had grants for internationally educated nurses, but those nurses had to pay those grants up front and then be reimbursed later. So now our government will be covering over $3,700 up front in application and assessment fees for internationally trained nurses, so that application fee does not stand in the way of them practicing in British Columbia. The bottom line is this: whether a nurse was trained in our province or not, we're ready to welcome those who are ready to care for British Columbians. Today's announcement continues our ongoing work to support more internationally educated nurses in British Columbia. Some numbers: since April 2022, a total of 5,500 nurses have said that they want to work in BC. 2,000 are in the registration and assessment process right now. More than 90% of applications were received after our government's initial actions to welcome internationally educated nurses into our healthcare system. There is still much work ahead of us, but I'm optimistic about the impact that these changes will have in a very real way for British Columbians. Now, I know that there are some who believe the way to fix our healthcare system is to abandon the principles of universal access to Medicare. They believe that the wealthiest should be able to buy their way to the front of the line, thinking that that somehow solves the line. It doesn't. It just changes who's at the front of the line. We can't cut funding and expect more doctors and nurses to show up. British Columbians couldn't afford that old approach to healthcare 5 years ago when they changed governments, and they sure can't afford it now. Everyone in BC deserves the absolute best in healthcare, no matter where you live or how much money you have in your bank account. That's my vision for British Columbia, and I know it's British Columbians' vision for how our province should work. A province where you can build a good life and know your family is taken care of. Thank you.
Thank you very much, Premier, and I think this is a significant day. It builds on the steps that the government took in April that have had an enormous impact, a positive impact on allowing and involving internationally educated nurses in British Columbia. It's something that is widely supported by the public, and it demonstrates the determination of all of the partners in healthcare. And you see many of them here today. Our College of Nurses and Midwives, which has been doing exceptional work, Canadian leading work in terms of removing barriers to people coming and practicing their skills in British Columbia. And our BC Nurses Union, which strongly supports investment in public health care and strongly supports these actions and welcoming new members of the BC Nurses Union, but also I think, and importantly, supporting those nurses when they get there, as we need to do in our workplaces across British Columbia, which is always a challenge and always an important consideration. So I want to thank all of you, and now I want to share the floor with my colleague, Harwinder Sandhu, the MLA for Vernon-Monashee, a nurse, and the Parliamentary Secretary for Senior Services and Long-Term Care, to say a few words. Harwinder? And wait a second.
Oh, thank you. So kind of you. Thank you. I always wish I was a couple inches taller, but this does it. So, hello everyone. Thank you so much, Minister Dix, for a warm welcome. Good afternoon, everyone. So good to see you all. I would like to acknowledge with respect that we are able to gather here today on the traditional territories of Musqueam, Squamish, and Tsleil-Waututh nations. It is such a pleasure to have an occasion like this and to share the floor for the first time. I want to acknowledge my colleague, my friend, Susie Chant, MLA from North Vancouver Seymour, who has been also a registered nurse for decades, I think more than 3 decades, and Susie still works as a nurse on casual basis. And it's incredible to have another nurse on the government side. So when we're shaping the policies, doing the work, it's really encouraging to see the support of government. I also like to, Susie Chant, MLA Chant, is also a Parliamentary Secretary for Accessibilities. I also would like to acknowledge my colleague, Mabel Almore, MLA from Vancouver, Kensington, and previous Parliamentary Secretary for Senior Services and Long-Term Care, who has done phenomenal work and advocacy to support nurses, internationally educated nurses, and healthcare workers in general. In fact, when I went to the legislature in Chambers in April 2014, I was MLA Mabel Almore's guest advocating for internationally educated nurses. We were in the opposition then, but we have the support ever since from the BC NDP government. So that is how I met, and now we sit next to each other in the legislature. So who knew? It's incredible to be here. I want to acknowledge my sister, fellow colleague, Aman Grewal, President of BC Nurses Union, and Cynthia Johansen, CEO of BC College of Registered Nurses and Midwives, and our guest speakers, Monique and Janine. Thank you so much for being here today. Today's announcement has a great meaning for me. Before entering into public life, I had the honor of serving as a registered nurse for almost nearly 2 decades in BC, first in Terrace and then Vernon, so the riding of Vernon-Monashee, which I represent. I am also an internationally educated nurse. And at the time, people, when asked me, when I made my way to become patient care coordinator, and a lot of people asked me, oh, this is really encouraging to see you doing such a good job. I said, don't ask me how I got here. It took me many years and several years and many tears. But now we're changing that. We're changing that for the good. So, working in Northern Health Authority in rural communities, and then later in the Okanagan, working in various healthcare settings from acute care to community to long-term, I got to meet many, many people from different walks of lives, also to meet with many healthcare workers. Every day, my colleagues, the nurses of British Columbia, take care of their patients with great skills, compassion, and knowledge. While they deliver care with precision, they also embody a sense of hope and possibility, which make the demanding work of healthcare meaningful. 3 years of pandemic have presented unprecedented challenges for most people, but our nurses and all our healthcare workers, they continue to work undeterred and with so much hope and possibility and the positivity. They deliver excellent care every single day despite the challenges they have been facing. Nurses also face life decisions too, and some of them have chosen left nursing to pursue other goals. But when given the opportunity to do this rewarding work, we need to support them. They say once a nurse is always a nurse. We may take leave or we may retire, but once we become nurses, nobody can take that nurse out of us. And that is why we're gathered here today. As you heard from our Premier, we are going to support Canadian trained nurses in BC who want to return to practice by removing some financial barriers. This will help them to get reassessed and trained faster so they can contribute to the public health service more quickly. This step our government takes is incredible, significant, and most direct. By supporting our nurses, more patients in British Columbia will benefit. I am also proud that our province has one of the most diverse populations in Canada, and there are many reasons internationally educated nurses may want to work here. The financial support we're announcing today for internationally educated nurses to help for them to gain accreditation quickly will be more reasons why they will choose British Columbia. Besides, it is a beautiful province and it also has a wonderful, diverse population. We have a great healthcare system that value and respect nurses, a system that is equitable and accessible for all British Columbians. These value-added incentives are important factors to new Canadians as they build their lives in our province. By streamlining the registration process and by providing bursaries for skill upgrades, internationally educated nurses can now work in their trained professions faster. Moving to a different country is difficult as it is, but knowing that the government is here to set us up for success, we will in return build a stronger BC together. As a nurse, it is reassuring, and I'm sure my MLA Chad, my colleague, can attest to that. It is incredibly reassuring to have a government, to have health minister who works sincerely and have premier and government. We've seen them working diligently with sincerity, with the dedication, not only to support healthcare workers, but also to strengthen our healthcare system in general. And before I welcome Minister Dix back to the podium, I would like to say that this is my first opportunity to speak an event as the Parliamentary Secretary for Senior Services and Long-Term Care. It is truly an honor to have this start in company of you, Minister Dix, and my colleagues and guest speakers, and all of you. I would like to say thank you so much for making this day so special and letting me be part of this. Thank you, Mr. Dix.
There we go. Thank you. That was great. Thank you, Harwinder, and thank you for sharing the unique perspective you bring to this work. As you know, over the last couple of years, Mabel Elmore has done this work and really worked on this question of both accreditation, but also of internationally educated nurses in particular. And you're picking up on that, and your extraordinary experience really assists in that. So thank you very much. And I want to now introduce one of the many partners in our work in healthcare, the president of the BC Nurses Union, Aman Grewal. Aman?
I'm thinking I may need it. Thank you.
Good work. Hands off.
Oh, this one. So thank you very much. I'd like to begin by sharing my respect for the traditional and unceded lands of the Squamish, Musqueam, and Tsleil-Waututh peoples of the Coast Salish Nations, lands on which we are gathered here today. As president of the BC Nurses Union, representing more than 48,000 nurses in this province, I am pleased to be here alongside Premier Eby, Minister Dix, and our fellow nursing professionals. Thank you so much for being here. Today's announcement of investments in supporting both internationally educated nurses and those interested in returning to practice offers hope for a strained and understaffed healthcare system. For years, BC Nurses Union has been advocating for improvements to help streamline the application process for IEN's internationally educated nurses, and the BC Nurses Union welcomes this as a promising step forward. We believe these internationally educated and trained nurses, professionals, bring valuable experiences, skills, and knowledge to a healthcare system that is in desperate need of nurses. We are optimistic that the efforts to remove barriers for not only the internationally educated nurses, but also those interested in returning to practice will provide meaningful supports for these nurses who are eager to provide patient care in our province. Not only will the addition of these nurses alleviate some of the pressure on the current state of our staffing crisis, the diversity that Harwinder was speaking about and the experiences that they bring will help to serve the cultural needs of our patient populations throughout the healthcare system. While much work remains when it comes to addressing the nursing shortage in this province, these initiatives announced today are very positive steps in the right direction. And I just want to say that we look forward to working with all parties to welcome these nurses into the workforce and here into BC. So thank you.
Thank you very much, Aman, and thank you for all the work of nurses. And, you know, we reflect on the last 3 years, but you can reflect on the last few weeks. We in BC, as you know, had a very serious accident with a bus, and the response of the healthcare system, it was unbelievably tragic circumstances for everybody involved. And the response on Christmas Eve of doctors and nurses and health sciences professionals and healthcare workers and, of course, ambulance paramedics to that accident demonstrates it's profoundly moving to see after all 3 years of pandemic and everything else, that response was remarkable on the ground, and it reflects, I think, the work of nurses everywhere. So I know we all understand that in theory, and we all understand that every day is a challenging day, but also when you're dealing with people who need help and need to get well, but also this has been a particularly challenging period, and we are very grateful for the work of nurses across BC. I want to say this announcement today and the work we've been doing couldn't be possible without our partners at the BC College of Nurses and Midwives, and their partners, such as the leadership here at Langara College and everyone here at Langara College who is part of that partnership. We're honored today to have with us Mark Heldman, who's the VP Academic of Langara College, and Yusuf Farachia, who's the VP of External Relations and Community Engagement. Thank them for their help today, but also their help every day in making the work we're doing and we're announcing today a reality and make a difference for individuals, allow them to achieve their professional aspirations, but as well for our healthcare system as well. So, and I'm sure Cynthia would agree with that. It's my pleasure and honor to introduce the CEO of the BC College of Nurses and Midwives, Cynthia Johansen, to say a few words. You get a step.
Thank you, Minister Dix. It's an absolute pleasure and delight to be here. But before I start my remarks, I just want to acknowledge that we are gathered here today at Snow-Waylatham, which is also Langara College. That's the Musqueam name that has been given to this amazing center of learning. It's also on the unceded and traditional territory of the Hunkaninam-speaking Musqueam. I am grateful to the First Nations people of this province who for thousands of years have looked after and protected these lands. The BC College of Nurses and Midwives regulates more than 68,000 individuals. Currently, 6,308 of them are internationally educated nurses. We know the journey to securing a career in the health professions can be more challenging for those who are new to our country. The new registration process announced today aims to reduce the time it takes to become registered by increasing efficiency, reducing costs, and focusing on the most important elements that will allow an individual to demonstrate their ability to practice competently and safely in British Columbia's strained healthcare system. For many years, the college has been working with the Nursing Community Assessment Service, and my colleague Rita Parikh is here today. The service aims to develop and implement, and has developed and implemented, a performance-based assessment process that allows internationally educated nurses to show us what they know, what they can do, and how prepared they are to work in our current healthcare system. Over time, as a regulator, we've moved away from spending time reviewing documentation describing an applicant's educational credential and experience. And even though that is important, it is not the sole contributor to their skills as a nurse. The new NCAS triple track assessment and our new improved IEN pathway application process is the culmination of significant efforts to challenge the status quo. We want to help applicants to gain registration in the right nursing role as quickly as possible, ensuring that the time that it takes for them to enter our country and gain good, reasonable employment is significantly reduced. And as you heard the Premier say, it's taking up to 3 years for individuals to get through the process now. That's not acceptable. We aim to reduce this to 4 to 9 months. I want to thank, in particular, the staff at the college and at the Nursing Community Assessment Service who have strived to find more innovative ways to look at an applicant's skills and experiences and to match them with the needs of our healthcare system, and doing so without compromising public safety. I also want to thank the staff at the Ministry of Health and Minister Dix for their ongoing support in our efforts to consider new, innovative, and modernized ways to regulate in the public interest. And most importantly, I want to thank those applicants who choose to engage with our college and who choose to pursue a career as a nurse in British Columbia. You, Jenny, Monique, bring value to our healthcare system, not only by the virtue of the career path you have chosen, but through the lived experiences and the care that you will bring to the patients and families and communities you serve. Thank you very much.
Thank you very much, Cynthia. Obviously, we're proud to continue our collaboration with the college. And I wanted to note that announcement that we made in April, which we've talked about some of the progress today and how we're building on that progress. We announced the consolidating the provincial-based assessment processes for IEN candidates. We offered approximately $9 million in bursaries to help with assessment fees. And we created new nurse navigator positions to help internationally educated nurses navigate the assessment and licensing process. And building on that, the work has continued, and the steps taken today build on that success and seek to achieve even faster success. I'm pleased that other jurisdictions in the country have followed us in that regard. And sometimes I get asked when they announce their changes, whether we're doing them in BC. It turns out we did them in BC, and that they're following us, which is great that we're doing that work, all of us together. And at that announcement was Jenny Arsenault, and I've already hyped you up a little bit, Jenny. I'm not putting any pressure on you at all here, but as remarkable, I think, as Jenny's presentation was that day, is the work that she does every day for patients in BC. And so I'm really honored to introduce Jenny Arsenault again.
Thank you, Minister Dix. I'm honored to be here today. The last time I was here was when I took my NCAS assessment. My name is Jenny Arsenault, and I am an internationally educated nurse from the Philippines. I've been working as a registered nurse in Campbell River for more than 3 years now. I love working and I love British Columbia, but it was a journey to get here. In 2009, I graduated from Cebu Doctors University. I went on to work as a registered nurse in a hospital in the Philippines for 5 years. Moving to another country was a lifelong dream because nurses are not treated well and not fairly compensated in the Philippines. In 2016, I landed in Richmond on a student visa. I was 4 months pregnant and my husband was way back in the Philippines. I knew that I would have to study to practice nursing here, but I didn't expect to have to take several exams and pay a lot of money. I was pregnant throughout my studies and gave birth in BC Women's Hospital alone. I brought my baby to the Philippines to meet his father and extended family, then made the difficult decision to leave him there at the age of 4 months to return to Canada to complete the process of becoming a nurse. It took me 1.5 years to get my LPN license and 3 years to obtain my registered nurse license. And that costed me $40,000 in assessment, registration, and tuition fees. After my experience, I knew I wanted to make it easier and more affordable to other internationally educated nurses to fulfill their dreams of working in BC. In October 2022, I was invited by Rita Parik of the Nursing Community Assessment Service, or NCAS, to their very first staff retreat. During the session, we discussed the whole process as to how stressful the exam and the long wait was and how everything could be improved. I later joined an NCAS focus group that was working to improve the whole process and the website and the whole experience, how we could all easily find the information that we need as an internationally educated nurse. Clearly, NCAS wanted to understand how they could make the process better for internationally educated nurses. NCAS then worked with the government to make it all happen. I'm so excited that this day has now come. No more secrets. The new process will be much easier and faster for IENs. Rather than taking up to 3 years to get registered, it might take a year or less than a year or so. Having the registration and NCAS assessment fees waived will also be a big help, as it's already very expensive to move to BC from another country. These changes show that the BC government values and supports internationally educated nurses. I know these changes will inspire more IENs to come to BC and start a fulfilling new chapter in their lives. Last 2018, my husband joined me in BC and we are now both permanent residents. In 2019, we had a second son. My kids are now 4 and 6 and they're both Canadian citizens. And my family loves BC. We love the beaches, mountains, and islands that we get to explore. Both of our children have the initials BC. to represent our love for this province, namely Brandon Clark and Blaise Cassidy. We're all so grateful to be here, and I'm particularly grateful to be here doing what I love, caring for my people in the community. So many internationally educated nurses will benefit from these changes, and so many British Columbians will benefit from having more caring nurses at their bedsides. I want to thank NCAS, BCCNM, Health Match BC, and the government of BC for their never-ending support for internationally educated nurses. I can assure you that you'll be happy that you did. Thank you.
Thank you, Jenny, and thanks for caring for patients in Campbell River, and what an incredible story. I share your excitements about our progress to help more internationally educated nurses ready to practice nursing in BC, and I'm glad to see you here and many, many more like you. Like Jenny, our last speaker is also an internationally educated nurse. Please welcome registered nurse Monique Wee to the platform. Monique.
Thank you, Minister Dix. It is an incredible honor to be standing here and be part of this very exciting announcement. My name is Monique Wee, and I'm an internationally educated nurse from the Philippines. I now work at BC Children's Hospital since 2019. With BC easing the pathway for IENs like me, I am very excited to know that I will be working with more internationally educated nurses. My journey to becoming one was not easy at all. After starting my career in Philippines, I worked in Saudi Arabia and New Zealand, and specializing in pediatric emergency. In 2017, me and my husband decided to finally live together in Canada. While I was in New Zealand, I started the grueling process to become a registered nurse here in BC, thinking that it might be lengthy and exhausting. Sure enough, by the time I got here, I still hadn't completed the requirements. While I waited, I worked in reception and other jobs. Fortunately, I stumbled upon the BC government's Career Path for Skilled Immigrants program. They provided a lot of educational programs and gave me about $2,000 for educational expenses, which was helpful. I thought that would be enough to cover everything, but I ended up spending more than 10 grand just to get my license converted. I had to complete online courses, clinical programs, and finally sat the NCLEX, or the National Council Licensure Examination. Waiting was really frustrating, but I did not give up. Finally, on May 22nd, 2019, I became a full-fledged Canadian RN. However, the challenges continued after getting my license. It was very difficult to get a job because I really wanted to work in the hospital. I was so close to really going back to New Zealand when the manager at BC Children's Emergency Department finally offered me a full-time line. It took me 2 years to become a nurse here, while it only took me 6 to 8 weeks to get my license converted in New Zealand. And in Saudi, I only had to sit their council exam. The whole process here was lengthy, exhausting, and expensive. The changes announced today, along with the changes announced in April, will make a world of difference to IENs. Actually, in the unit I work now, I am the only IEN. However, a lot of our clerks, our care aides, were all nurses back in their home countries. They're amazing, they're helpful, they're very hardworking, and they're very, very capable of being nurses here. I can't wait to tell them this news, and everyone is going to be very, very excited. Even though the process to become a nurse in BC was by far the hardest of all the places I've worked, BC has been my favorite place to be a nurse. I just also love BC in general. It's beautiful and it's a very welcoming place. My husband and I now have a son, and we're grateful to have the opportunity to raise him here. The changes to the IEN assessment and registration process will give even more IENs the opportunity to establish lives here too. This will benefit everyone in British Columbia because more nurses means better healthcare. These changes show that the BC government values the education and experiences of IENs. To my fellow IENs, this is it. Finally, our voices are being heard. I am so excited to be working with you soon, and thank you for not giving up. And of course, I'm incredibly grateful to the BC government for this new pathway for IENs. We will not fail you. Thank you.
You don't need this, right? Okay. Thank you very much. This is another significant day in our efforts to build and to put in place a health human resources plan that meets the needs of our public healthcare system into the future. Over the past number of months, we've added hundreds, in fact, more than 600 new nursing spaces in BC colleges and universities. We've added 335 health sciences places in BC colleges and universities. We've created new pathways for internationally educated doctors, internationally educated nurses. Our HCAP program has added thousands of people to the long-term care and home support system in BC, and there is more work to be done and work that we will continue to do, including a new SFU medical school, including 128 new places for doctors at the University of British Columbia. In short, this is a comprehensive response, and we need, and we have the partners in place who support these initiatives to do it. And you can see that today with the support of our team in the NDP caucus, which has strong representation of nurses. You see it in terms of the support and the work for by the BC College of Nurses and Midwives, by the BC Nurses Union, and by nurses across British Columbia who support these initiatives even as they do the remarkable work that nurses do every day in our healthcare system. So we're very honored, very excited about today's announcement. That ends the announcement. We're now going to take questions from the media, and I'm going to invite Premier Eby back to the podium. Premier.
Thanks for joining us. We'll now take questions from the media. Media, please be advised you'll be limited to one question and one follow-up. If you're on the phone line and haven't already, please press *1 to enter the queue. We're going to start on the phone line with Richard Sisman, Global News. Go ahead, Richard.
Premier Eby, welcome back. We see these emergency operation centers open across the province today. The announcement you're making today is largely forward thinking, but what are you doing to address the severe staffing crisis we are experiencing in hospitals and other parts of the system now that is compounded by the fact that we are over 100% capacity at some hospitals across the province? And for Minister Dix, there's been one doctor quite vocal, Dr. Kevin McLeod, about Bill 36. In essence, he says your government is shutting down the ability of frontline workers to communicate directly to the public about the concerns they are seeing in the system. Are you, in fact, doing that through Bill 36, stopping medical professionals their ability to communicate around their concerns they're feeling in the system?
Thanks, Richard. I think for all British Columbians who are seeing the strain in our healthcare system as we see record numbers of people with the flu season that we're having, with the ongoing COVID pandemic, this is an incredibly good news announcement for them. This announcement means that there are nurses right now, 2,000 nurses right now that are in this approval pipeline that could be on the floor in hospitals within 90 days. It is a remarkable shift, and I don't want that to be missed. What we're looking for in government is to make sure that every opportunity that we can find around healthcare workers, making sure that they're assessed, trained, and on the floor working in hospitals that are facing that strain is what we're focused on. So, for example, we heard from Monique and Jenny on the international side. We also have nurses that have stopped practicing and are in community, are thinking about coming back, removing every barrier for those nurses to come back into our healthcare system, making sure that nobody is on the sidelines while we're facing this challenge in our healthcare system. That is our focus. That's what today's announcement is about. It's about responding to these conditions in hospitals, certainly for today, but looking forward around the sustainability of our healthcare system. This announcement will have important implications for that as well. I'll turn over to Minister Dix on your second question.
And just to note, Richard, when I became Minister of Health, we were last in Canada, last in terms of registered nurses per capita, and that we essentially didn't have any net new registered nurses in our province between 2009 and 2016. And those changes take a long time to make. And these actions, you need to take actions now to address the problems now, yes, but also into the future. And that is, I think, what Premier Eby described today. Bill 36, just for everybody who want to know what it is it's an amendment to the health professions. It's now called the Health Professions and Occupations Act that was decades overdue. It involved extensive consultation, including an all-party committee that supported its initiatives, all parties of the legislature. One of the most significant consultations ever on legislation with Indigenous communities, and reflect the urgent action we need to take pursuant to the In Plain Sight report and other things to make our system and to respond to issues of anti-Indigenous racism as well. It simplified the health college system by reducing the number of health regulatory colleges and by ensuring that the public has more access, not less access, more access to information that was previously not provided to the public when disciplinary actions took place. The most extensive, thousands of people involved in the consultation, the most extensive action, all parties involved in the process, extensive consultation with Indigenous people and with health professions. And I think it's a very strong piece of legislation, and we're going to be working with health colleges to see that it's implemented in the coming months.
Thank you. Follow-up, Richard?
Premier, I'm sure you've seen some of the video over the last week about deplorable conditions in SROs. I know it's something you've raised concerns about in the past as well. We're showing more tonight on Global around St. Helens Hotel, where the elevator hasn't been working for 9 months. I know there's a formal review under place now where an independent group will come in and review SROs, but does there need to be an immediate help here in terms of allowing people a place to get their concerns addressed about the living conditions in SROs? And for Minister Dix, we also have a story tonight, and our understanding is there has been a disagreement around mental health beds at Peace Arch Hospital. Your province announced it last year, but there are questions about who is going to staff it, and it currently is sitting empty with disagreements between the ministry and the health authority. Can you talk about what's going on here, and when will those beds start becoming functioning for mental health at Peace Arch Hospital?
Thanks, Richard. One thing is really clear to British Columbians, and it didn't take these latest news stories to make it clear to them. These SROs, these old residential hotels in the downtown east side, are not fit housing. We need to have a plan for phasing out the SROs, replacing them with dignified housing for people, and that's exactly what we're doing. For the downtown east side as a whole, we need an integrated plan, and we need someone to bottom line it, and that's why the provincial government has stepped up to do that work. We've had our first meetings convening service providers from the downtown east side, convening key stakeholders from the Chinatown community, from the downtown east side itself, convening different levels of government in all different meetings, talking about the future of the downtown east side, phasing out these SROs, getting rid of them, replacing them with decent housing, and having a unified plan for the downtown east side, starting with the encampments and moving on to providing proper housing. The SROs are actually feeding into our homelessness problem because during the summer when they're unlivable for people, they move out and they sleep in the park instead, even though they have a place that's technically fit for them to live. It is not acceptable to me. It's not acceptable to British Columbians. We're going to address it, but it will take some time. We didn't get here overnight in the downtown east side. I was working on these issues when I was a baby lawyer in the downtown east side many years ago. And disturbingly, The downtown east side, I haven't seen it worse. So we're going to take the leadership. We're going to make the commitment to British Columbians that we're going to do the work that's needed. The SROs are one symptom of the larger problem we face in the downtown east side, and we're not going to let it slide. We're going to work on it.
With respect to Peace Arch Hospital, as you know, we've made major capital investment in Peace Arch Hospital that was many years delayed. We found the funding. We've delivered and implemented those capital improvements to the hospital, which will increase the quality of care for everyone. And so with respect to issues around beds, I don't think you characterize it as a disagreement between the Ministry of Health and the health authorities. I don't think that's the case. And we're working to ensure that people have the services they need as soon as possible.
Thank you. Next question will be Mira Baines from CBC. Go ahead, Mira.
So this question is for the BC Nurses Union as well as Minister Dix. And Minister Dix, we're hoping to get the answer in French. We've seen some movement here on helping internationally trained nurses with application fees, but I'm wondering about language, and that's quite important in terms of getting their English up to speed. Will there be any support for that? We've heard of other provinces and problems with English proficiency tests. I'm wondering, is there more support in terms of training or money that's going towards that?
Premièrement, je dirais en français que la province va faciliter le travail des infirmières formées à l'étranger dans le système de soins de santé de la Colombie-Britannique avec ces changements aujourd'hui qui sont très importants en ce qui concerne les langues et la question de la compréhension et de langue qui est un élément important dans ces processus. Le Collège des infirmières est en train de faire et a fait des changements pour faciliter ce processus. En plus, il faut le dire que les bourses qui sont données vont jouer un rôle important pour aider des gens. Ça fait partie de la voie d'entraînement que des gens doivent suivre ici en Colombie-Britannique. Donc la réponse est oui à chaque question. I would say that I'm going to ask Aman Grewal and I'm going to ask Cynthia Johansen to speak on the issue of language and the issues of language proficiency, because if you see in the announcement today, there are changes in the way that the College of Nurses and Midwives has dealt and is dealing with those issues. With respect to the supports we're giving, yes, that's one important element of the training sometimes that's required, or the changes or the things that people need to do when they arrive here. These are significant changes that we're making. And in addition to what we did last April, we're ensuring that the supports are available up front so people don't have to pay and then get reimbursed, but they can go directly into the system. And certainly those language proficiency issues are a key part of that. But I'm going to ask maybe Cynthia first and then Aman to speak to this issue, if that's okay. Oh, yeah.
So thank you for the question. The college has actually been involved in a project nationally with other regulators of nurses to look at the standards and requirements, the benchmarks for language proficiency. And we've made some changes and we've implemented them. These changes not only help to ensure that we've matched the right score requirement on things like speaking and reading and hearing with the work that's required to nurse. So we have been very thoughtful about making sure that we do not in any way compromise safety by reducing or misaligning the requirements, but also ensuring that the requirements that we have in place are reasonable and that people can, for the most part, meet them. So that's what we've done, and we've made those changes. We've implemented a couple of other sort of process changes so that people can meet it up front and quickly. And again, the funding supports that have been offered by the provincial government will be key to helping move people through the process faster, so that if they have to take a language proficiency test, that they have funding in place to pay for it. So, thank you to the government, the minister in particular, for looking at ways to ensure that we have that funding in place for these international applicants.
Thank you for the question, and thank you to Cynthia for coming up first. So today's announcement just does that it ensures that there is funding available for our members who are future members that will be working at the bedsides, that they are able to have those proficiencies, and with mentorship and through Rita Parek's work that she does with the NCAS, that all is together a collaborative effort to ensure that this is a success for the internationally educated nurses. Thank you.
Thank you. Follow-up, Mira?
This is for Minister Dix, and English and French, please, again. This is about emergency operation centers. What specific data or factors were used to inform the provincial decision to reopen these centers? And what does that signal about the current stage of the pandemic?
Well, the reason we put them in place and we've been preparing for those is we saw relatively high levels of census in our in hospitals over the Christmas period and then just past it. So on December 31st, for example, we had roughly 9,600 people in hospital in BC at a time when generally overall census should be going down or should be lower than that. We expected as we came back to full operations for surgeries and everything else last week that we'd see that number increase, and it did, to a high of 10,280 last Wednesday, to 10,226 on Thursday, which was part of my announcement on Friday. Today, that number is 10,061. Just to put it in context, it bounces around and it has trended down over the last 4 or 5 days. The reason you put this in place right now is to support our staff and to support patients, to make sure that if patients need to leave the hospital, they're ready to leave the hospital, that they have the supports necessary to put that in place. And there's a series of measures that have already been taken to do that. People added in staffing place, patient care coordinators added to support that work that's done by the health system. So what was the standard? The standard's pretty straightforward. There are a lot of people in hospital, historically high levels of people in hospital, that we're facing the most challenging period in healthcare, which is typically January and February. We're in the midst of a respiratory illness season and a pandemic that's health systems are dealing with around the world. And so the reason to put these emergency operations centers in place across the province was to assist in that, support our healthcare staff, and mostly to support our patients in challenging times. So that's the reason they're in place, and that's why we put them they're at that level. En français, je dirais tout simplement qu'il y a beaucoup de monde à l'hôpital. Et c'est vrai un peu partout dans la province, n'est-ce pas? Et nous avons mis ces centres en place dans 20 hôpitaux, un peu partout dans la province, dans chaque région de santé. Parce qu'il fallait le faire, nous avons eu, jeudi dernier, 10 226 personnes à l'hôpital. Aujourd'hui, c'est 10 061. Et je pense que c'était nécessaire pour soutenir nos travailleurs, nos professionnels en matière de santé, nos infirmières, nos médecins et nos travailleurs en matière de santé, de les soutenir dans une période difficile, de mettre en place 7 jours sur 7 des soutiens pour les gens, les patients dans les hôpitaux et surtout ceux qui sont prêts à quitter l'hôpital et qui ont besoin des soutiens dans la communauté, d'assurer 7 jours sur 7 que ces processus sont en place pour des gens et pour soutenir nos gens, les gens qui sont malades dans la province. Et c'est ça la raison pour laquelle on a pris cette décision.
Great. Next question will be from Lisa Yusta, City News 1130. Go ahead, Lisa.
Good morning. Just following a bit up on Mira's question about financial support. So what support is there? You know, Jenny talked about spending thousands on education after her application, and Monique talked about thousands yourself as well. So what support is there for additional education that IENs will receive when once their application process is approved and they're told you need to do these X number of courses? Is that paid for, or do they have to, is there funding available for that?
No, it's all right. Yeah, you do it. You do it. Yeah.
It's pretty straightforward. It's a very expensive assessment process for internationally educated nurses. And there are costs for nurses who are returning to practice. And so in both cases, those are bursaries of up to $10,000, which help create and help pay for the various costs people have both to meet and to pass those requirements. And this is a significant impediment. And what's changed today, in addition, is that a significant number of those costs will be paid upfront by essentially the Ministry of Health directly to the college, and not have people have to put the money up front and then apply afterwards, something that is very challenging for people. So as we went through this process, which has received, I think, an exceptional response in the last few months, where since April we've seen a significant increase in both interest and application to practice in British Columbia. This was one of the issues that we wanted to address, and that's why these funds are in place. And I think it represents an important change for people so that they're not dramatically out of pocket. This is, let's be frank, nurses are in significant demand, and to put impediments in the system, both in time, which costs money, and in costs for people simply to apply and go through our process is not the best approach. We want people working, providing care for patients, whether it's in Campbell River or anywhere else in the province. And that's why these changes have been brought in.
Follow-up? Lisa, do you have a follow-up?
Yes, and I suppose this is for you, Minister Eby. I've just called you Minister, Premier Eby. The funding is coming to people around the province, that the one-time not a rebate check, but like bonus check for people in the province to help with rising costs. Wondering if there's anything more that people will see before the budget, or will any other additional supports be held off until we see it in the budget?
So certainly we understand that British Columbians are facing cost pressures today, rising costs that are affecting their ability to do things like buy groceries and make rent and so on. And so we've certainly taken the approach that British Columbians need support immediately. So in the first 50 days of my new role, we have done things like the BC Hydro credit, $100 credit for people on their hydro bills. We've done support around the affordability credit that you're talking about, making sure that low and middle income British Columbians have support with the costs of everyday life. We've frozen car insurance rates for 2 years. For parents with kids in childcare, they are seeing literally thousands of dollars in some cases in their pocket every month that they used to have to spend on childcare. You can expect that we will continue to take this approach to affordability in the province. Every opportunity we see to support British Columbians, we will do so because we know that families and seniors and individuals are feeling the strain in our province right now.
Next question will be Binder Sejan from CTV. Go ahead, Binder.
Hi there. I'm just wondering if you can talk a little bit about, and maybe this is for Aman and maybe for the minister as well, in terms of the gap in terms of how many nurses are actually required right now. When we look at those who are in the application process, when you expect some of those nurses and maybe on the front lines in healthcare, and also, you know, what you expect that gap to be in the coming years due to retirement. So, you know, how far along we are in terms of addressing the gap in nursing.
Thanks. We've seen remarkable uptake since the changes that that Minister Dix announced with key partners recently around internationally educated nurses. We have 2,000 nurses right now that are in the approvals pipeline with the college, with the assessment service. And those are the nurses that are going to see benefit right away from this announcement today, where I understand that there will be nurses potentially on the ground within 90 days of this announcement, thanks to these changes. Beyond that, I understand there are more than 5,000 nurses that have expressed interest in coming to practice in British Columbia, and addressing these barriers of the upfront costs, the length of time of training is going to help encourage them to go from being interested to actually making that application and starting work. So we need all those nurses and more. We have more than 600 new spaces in post-secondary education training new nurses. So it's all hands on deck to get nurses there. In terms of specific numbers, I'll turn it over to Minister Dix to provide some context.
Well, just the context is what you know. We were last in Canada in 2017, last, meaning You know, 10th would be good if it was the United States and there were 50 provinces, but there's only 10, and we were last. And we were last by a good margin. And we were last because of some deliberate policy decisions been made by governments. We expect the highest level of nursing in British Columbia. And all the people here, the college, the BC Nurses Union, everyone else supports that. We have led Canada in new registered nurses per capita since 2017. But when you start from last, you've got a ways to go. So being number one isn't enough. So the answer is we need to do it all. We need to support people returning to nursing. We've done that during the pandemic on a temporary basis with the support of the colleges of nursing, support of the BC Nurses Union. We've got to continue to do so. We've got to improve pathways for internationally educated nurses, but we can't just depend on other jurisdictions to support our health system here. So we need to add spaces in BC. We've done that as well. We need to allow and support nurses who want to progress in their career and take on new responsibilities and new opportunities. Jenny talked about LPN to registered nurse, but also registered nurse to nurse practitioner. We've more than doubled the number of nurse practitioners we have practicing in British Columbia in 5 years. Again, we were last. Now we're not. We need to do better. So the answer is we need to do all of these things. And this is a very important part of the Health Human Resources Plan, we need to retain people who are nurses. And that means addressing quality of life in hospitals and in the community for nurses. We've got to address issues of attrition because we need to bring people here and support them when we're here. And that's why the important changes to improve security and to improve safety of nurses that we worked on in collaboration with the BC Nurses Union and the Hospital Employees Union and the Health Sciences Association that were brought in place a few months ago that received their support are so important. We need to improve quality of life as well.
Thank you for the question, Binder, and thank you, Minister Dix and Premier Eby. So I welcome news to hear that there are 2,000 nurses in the process right now to take advantage of today's announcement and that there are 5,000 wanting to come here. At the moment, there are, as of this past spring, 5,200 vacancies here in BC, and by 2031, we need 26,000 new nurses. And so these announcements today that there are these numbers of people wanting to come in to work here in BC is very welcome news and will help to fill some of those gaps. So we're looking forward to being able to have these nurses come in and to mentor them because they will need the mentoring and supports along the way. And it's going to be exciting for us to be able to get more nurses to support the nurses that are already on the front lines. Thank you.
Do you have a follow-up, Binder?
Sort of what the overall cost for this program is expected to be. Is that money coming from this budget year? Will there be money in the coming years as well for this as well? And also just wondering if there are any other barriers that you see to internationally educated nurses or others getting back into the field.
Yes, and I think if you look at the details of the proposal, you see the many steps the BC College of Nurses and Midwives are taking to address that, including addressing issues of language that Cynthia Johansen just spoke to issues of assessing the value of credentials from other jurisdictions and broadening that out so that people can start to work in British Columbia and start to work quickly. The triple track changes, allowing people to be assessed for multiple positions in nursing that we introduced last April are part of that. There's more we can do and more we are doing. That's significant. All of this was budgeted for in the current budget year, so it's in the base and will be funded in previous years. We're not the issue here. The value of this work is cost saving and not costing us money, because filling positions and having people come here and work assists all of us and assists existing nurses, as you know, because we've talked about this many times. The challenge of overtime is not just a challenge of cost for the system, but it's a personal challenge for many nurses in our system. And so having people step in and do this work means that the money we spend to support new nurses coming into the system is always money well spent.
Thank you. Next question come from Rob Shaw, Check News. Go ahead, Rob.
Hi, Premier. You're halfway through your 100-day plan. Are you where you wanted to be when you started? And talk to us a bit about that.
Thanks. It's been a very exciting first 50 days, and I'm very grateful to many partners in British Columbia who have come forward to support us in making necessary changes to make sure that we're fulfilling our mandate and our commitment that we made to British Columbians in the last election. I'm really happy with how the first 50 days have gone, providing support to families, seniors, individuals across the province financially through their hydro bills, through the affordability credit, through the child care support, through freezing ICBC rates, making sure that the rents are under control for renters that are facing additional expenses, and putting into place the frameworks that we're going to need to move forward on critical issues around public safety, including issues like the downtown east side and other issues in downtown cores across the province, new police officers, but also new mental health responses to make sure that police are focused on crime instead of responding to mental health. Around the healthcare system, today's announcement, the deal that Minister Dix and his team worked out with the physicians, the work that has been underway with the paramedics, that continues with the nurses to make sure that our healthcare system is strong going forward. I'm really excited about how the first 50 days have gone. I'm looking forward to the next 50 and the next 50 after that.
Do you have a follow-up, Rob?
Yeah, I mean, it's an impressive list when you write it down, but you've sort of mentioned again today that you gauge the success based on visible progress that people see, in a tangible way in the real world. And when you look at healthcare or, the downtown east side or whatever, it's a little bit harder to make the argument that things have visibly improved. So can you reconcile for us the 50 days of accomplishments and the sort of lack of overall improvement in the big areas that you've been talking about?
Sure. There are British Columbians today that have more money in their pocket for the expenses of everyday life than they did on day one when I started. This is parents with kids in childcare. This is people who pay BC Hydro bills. This is people who are low and middle income in our province, facing increased costs. There are people right now who are renting strata units that previously it was illegal for them to rent. I've had two people in my own constituency come forward and say, listen, thank you so much for making that change around the condo units. I have rented out a place. I moved in with my boyfriend, a young woman told me, and I wanted to keep my place, but I wasn't allowed to rent it, and so it was sitting empty, and now I'm renting it out. And that makes a difference for people in ways that they can see and touch. These are real things in the first 7 weeks on the job. And today's announcement, this will mean new nurses on the floor of our hospitals in 90 days. So we're moving quickly to address these issues that British Columbians are seeing in their community. And of course, there are pieces that take longer to put in place. You need to train those new police officers before they're in the community. You need to train those community mental health workers. But that work is happening right now. It is underway. And in those 18 months that I have, that our government has before the next election, that is my goal, that British Columbians are going to see those changes on those issues that are priorities for them.
Great. Next, we're going to come to the floor with Ryan Bailey from BCIT News. Go ahead, Ryan.
So how do you plan on encouraging more young people coming out of secondary school to consider nursing as a career? Because many of them are feeling very discouraged or not even considering it in the first place.
First of all, it's the best work you could possibly do. It's the best work you could possibly do, helping people when they need help. It requires an extraordinary level, and I think this is true of nursing in Canada, where the level of autonomy for nurses in Canada for opportunity is exceptional. And of course there are challenges, of course there are, but we have, I think, more opportunity for nurses than we've ever had. We have, in fact, one of our issues is that there is so much opportunity because we're going to continue to see demand in healthcare. If you want a profession that will give you satisfaction your entire life, where you'll be able to grow in your profession, nursing is an extraordinary choice to make at every level. And if we know anything during the pandemic, dealing with all of the issues that we have to deal with, the role of nursing has become more important, more significant in our system, and it will. We're going to have twice as many people over 75 in 10 years. right? Which means that healthcare is going to be required. We talk about needing thousands more nurses in the future. It's for that reason. It is exceptional work. It is skilled work. It is satisfying work. You have extraordinary colleagues and support, opportunities to grow in the profession. I think young people are going to take up nursing and take up those hundreds of new spaces there are for nurses in every part of the province. And I think what's finally important is that it's not just here in Metro Vancouver. If we're going to have nurses caring for people in Fort St. John or in Smithers or in Prince George, we need to train people in those places. And that's what we're doing. And that's what's changed as well. And so it is an exceptional opportunity. And I want to say finally, we have lots of work to do in terms of healthcare, in terms of ensuring that Indigenous people at every level in our healthcare system are supported and are leaders in the healthcare system. And that involves nursing as well. So we're creating more opportunities. There's significant opportunities for people to take. It will be, I can tell you, because all of the evidence suggests this, a lifetime of work and opportunities to grow and be supported and do something that may be more important. Everything, of course, that people choose to do can be important, but it's hard to imagine of something more important to people in our province, in our communities, in our neighborhoods than nursing.
Do you have a follow-up, Ryan?
Yeah, so there's been significant investment into these educational facilities, but can you talk a bit about how the enrollment numbers have been and if you're seeing what you've been expecting for these facilities?
I think the enrollment numbers are good. I think the opportunities are very good, right, in nursing. We've got to continue to make the case. I'll just give you an example, which is part of nursing. It's healthcare assistance. We started a program that was deeply tied in to post-secondary institutions in BC called the HCAP program, which along with other infection control, work in infection control, were major initiatives at the time when long-term care was at the center of the pandemic. Well, we've added net 7,000 people to that system, right? And they've come through in large respects BC post-secondary institutions and are working as healthcare assistants. And we changed the way that we dealt with healthcare assistants to a group of workers who had been treated, frankly, disrespectfully for decades prior to 2017. And we raised their level, their rights, by getting rid of a bill called Bill 29, which is significant. During the pandemic, when we put in a single site order, we raised the salary level of people who are in the contracted sector to make that valuable work to do, so that people can do that work that is so essential to people living in long-term care and actually be paid and respected to do that work. And that change has made a dramatic difference, such that we promised 7,000 before the 2020 election. We delivered 7,000 people in a labor shortage economy, which is an exceptional achievement. So yes, I believe people will come. And it's very important that in addition to the work we're doing with internationally educated nurses, that we continue to train people here. And when they enter the workplace, that we support them there sufficiently. And that's the work we have to do as well and shouldn't be forgotten when they get there.
Next question, going back to the phone line with Rob Buffum from CTV Vancouver Island. Go ahead, Rob.
Oh, hi there. I'm just trying to get some clarity in terms of the actual number of new nurses you anticipate will be working within 4 to 9 months as a result of today's announcement. You've talked about the fact that there's 2,000 nurses in the system that will be expedited and 5,000 or some odd who'd expressed interest. But realistically, 9 months from now, how many new nurses will be working in BC as a result of today's announcement do you expect?
Well, what we'll be doing is reporting regularly on success and reporting that out to you. And so different nurses who are in the system now are at different points in that system, 2,000, that 2,000, and we expect more and more into the future, because this is a process that will build now and into the future. So what we'll do, Rob, is not talk about what we expect, but rather report on what is happening in the system, and you'll get regular reports on that to inform your viewers about.
Follow-up, Rob.
Yeah, this question is for Ms. Grewal. I'm wondering about, you've called today's announcement some very positive steps, but acknowledged more needs to be done. I'm wondering, we've seen as recently as November, 200 nurses outside Nanaimo General Hospital rallying and protesting because they're overwhelmed. What do you think their reaction will be, and what is your realistically, and what's your reaction as this going to make a big dent to the situation where many nurses are feeling overworked and overwhelmed?
Well, I think this gives them hope. And that's what we've all been waiting for, is hope that there are nurses coming, because throughout the pandemic and prior to the pandemic, the opioid crisis and the staffing shortages that they've been dealing with, you know, they are looking for some relief to be able to have a work-life balance. And so I think that this brings hope, and I hope that those nurses are listening and will see that there are nurses that are wanting to work. This is such a noble profession. I've been at it for 36 years, and I have to say, you know what, I'm still proud to be a nurse. I have had the wealth of experience to work from a surgical unit to pediatrics to emergency, diabetes clinics, a site leader, patient care coordinator, you name it. The opportunities are so great, and I encourage everybody that is interested to get into the profession to please get in. I do understand from Cynthia that there is a wait list at all the schools, but you know what? That's a good thing to hear, that there are wait lists. So this gives us hope. Thank you.
And our last question will be coming from Justine Hunter from the Globe and Mail. Go ahead, Justine.
Hi, thanks. Rob asked what I was hoping to ask, so thank you for doing that, Rob. But let me just try and follow up. I'd like to get a sense of the net increases in nursing. So you said 38,000 net new healthcare workers. What is the figure for nurses, and can you give us a sense of the attrition rate?
Yeah, what I'll do is I don't want the numbers from the last month or so, but what we can easily provide that, and we will in the next hour, Justine. And there's a number of ways you can look at it, but number of nurses who are licensed in the province as registered nurses and LPNs. So we've been leading in new nurses since 2017, but obviously compared to other jurisdictions, we have less nurses per capita than other jurisdictions. We do because we started at a lower level after a number of years of, frankly, intentional steps that disrespected the value of care. And so we're taking those steps, particular steps that happened for registered nurses in 2009 and 10, and obviously happened for all nurses in 2002.
Do you have a follow-up, Justine?
Yeah, thanks. You've said a few times here that BC was last in amongst the provinces in 2017 in RNs per capita. So where do we rank right now?
Well,
and of course, sorry, let me finish because I'm going to try and do a Richard Zussman and jam one more question in here. Other provinces, of course, are also trying to improve their programs to recruit these same nurses that we're trying to attract. So how are we doing compared to other provinces in recruiting these nurses?
Well, I think we have to work with other provinces. I think it's the responsibility of all jurisdictions to work together to increase the number of nurses we're training domestically in each of our jurisdictions, because we know, and people know who live in Canada know that frequently people come from other parts of the country, and frequently they come from other parts of the country to British Columbia. So all of our jurisdictions are working in the same direction. We made our announcement in April, other jurisdictions followed, and when they take steps, we look at them as well to see what we can do. So we need to train more, all of us. We need to provide better pathways to internationally educated nurses, all of us. The federal government has to play its role in supporting healthcare in Canada, something it seems increasingly reluctant to do, but they need to be involved as well. And so when you ask where we are since then, we're number one in terms of the number of registered nurses per capita added to the system since 2017. And again, we can give you those details to the number year by year to show that in time for your deadline, Justine, and look forward to doing that. So we were 10th, we are first, but we've got a long way to go. And ultimately, it doesn't matter. And I think Harwinder and Susie and Aman would agree with this. It doesn't matter whether we're better than New Brunswick, although we were worse and we're now better. It matters that we have nurses there to treat patients when they need it and to support other nurses so that they can live positive, fulfilling lives outside of the workplace and in the workplace as well. So what's important is the nurses that are on the floor, and that's why, while we've done well relative to other jurisdictions. We got to do a lot better in the next few years.
Thank you for joining us.